You're very inspiring. And I don't want to be Debbie Downer here, but there's a sense of hypocrisy. Even today, from the Midwest, we just heard that the state of Iowa, Medicaid system will drop their coverage for bariatric surgery. With all that we know in today's surgical world. And this is a population that's not getting off Medicaid. So they can't say they're looking at the short term. What can we do as surgeons to fight this? I'm afraid it's going to be a domino effect. Then it'll be in the state of Nebraska, and then it'll be Medicare. How do we stop that from happening?
Well, a lot of it is that a lot of politicians simply don't understand the economics of the healthcare system. And they truly believe that if they just cut a dollar today, that that's the urgent thing to do. And what they don't understand is that you may cut the dollar and spend 20. I'll give you an example. You mentioned Medicaid. This is a specific thing we dealt with in my state. When we had severe economic shortfalls in 2001 and 2002, the recession that happened then, we were looking at everywhere to cut. And one of the things people came to us was on the optional pieces of Medicaid, the things that are not federal mandates but are state options. One of our state options was we covered eyeglasses for elderly people. And there were some people who said, well, let's just cut out the eyeglasses because it's not a life or death thing. But here's the problem. You cut out eyeglasses and guess what? It's a person who's 75 years old. They don't have their eyeglasses. They reach for a prescription bottle. They can't read it. They take the wrong thing. And they end up in anaphylactic shock and they're in the hospital for 4 days. Guess which costs more? $50 for eyeglasses or 4 days in the hospital. What if they don't see the top step and they're walking out of their house and they trip and they fall and they break their hip? Guess what? The surgery for the broken hip and the rehab and the long-term care is a heck of a lot more than the eyeglasses. So it's a matter of then helping those policymakers to understand, don't make policies that make sense today but cost you more long-term. It's a lobbying process. It means you'll have to be politically active. But it doesn't mean that you yell and scream. It means that you sit down with your elected officials and you rationally explain to them the harsh facts that all of you here know. You do it calmly. You do it, again, consistently. And you do it aggressively. And if they refuse to listen to you, you work against them and you get them fired. And you hire somebody who has a little bit of common sense when it comes to the fact that we are not going to resolve the extraordinary healthcare cost in this country by simply cutting things that in the long term actually do save more money. So that's a specific example that I can point to. And I'm sorry to hear that the Medicaid program in Iowa is looking at cutting out surgical interventions. Because I think, again, the facts are overwhelming